When Professor Muhammad Nasir Sambo assumed office as the Executive Secretary of NHIS, his target was to make sure every Nigerian, irrespective of status, is covered by health insurance. That is what universal health coverage means. How does he achieve this? Given the nature of health insurance, this will require going into partnership because health insurance does not depend on the NHIS alone. There are several other bodies involved, and so the initiative of health insurance under one roof was born. The program tonight brings you an insight into this initiative and how far it has helped to increase coverage. My name is Aisha Muhammad Ahmad, your regular anchor, welcoming you to the program, Easy Access to Healthcare for All, sponsored by the National Health Insurance Scheme. Join me after the break for more on this. Keep watching.
Easy access to quality healthcare for all. NHIS.
We begin the program with the news. In our lineup, NHIS holds two-day workshop for healthcare providers.
Executive Secretary of the NHIS, Professor Muhammad Nasir Sambo, has charged healthcare providers to educate enrollees of the scheme on how it operates. Professor Sambo stated this at the opening of a two-day meeting organized for stakeholders and healthcare providers in Abuja. The ES explained that enrollees are not well informed on how to access healthcare under the NHIS.
Enrollees are not well informed as to how do you go to a primary healthcare facility, and from the healthcare facility, if you require a referral, you need to obtain a code from your HMO. And some of them will believe in the fact that if they go to a facility, they will be treated both primary, secondary, and everything should be done to them. So a lot of concerted effort has to be done. If we have a managed care system within our organization, just as we do antenatal care where we enlighten people, we can create enlightenment session with the healthcare, with the enrollees, so that they continue to learn the basic requirement of and operations of the health insurance. It will make our life easy in the process.
Professor Sambo also said poor knowledge on the scheme is responsible for misconceptions about issues like drugs administration and why some enrollees seek for services outside the package approved for them.
There is this perception that the health insurance enrollees are always giving cheap drugs. They are not giving expensive drugs. Enrollees are not aware of the fact that generic and branded drugs are the same, are one and the same. Only that maybe this manufacturer is a very popular manufacturer and so on and so forth. So this underscores the need for enrollee education. We must work in collaboration with health maintenance organizations and healthcare providers to be able to enlighten enrollees. You cannot practice health insurance in an unenlightened environment. Where we must concede that a lot of our enrollees are being turned back from the healthcare facilities on services that they are entitled to. Some of the enrollees are also demanding services that are beyond what is supposed to be given to them. And that boils down to enrollees' education. Very, very important.
The two-day meeting brought stakeholders together to engage with healthcare providers in order to address all problems facing the scheme.
Welcome back. The program is Easy Access to Healthcare for All. The NHIS is saddled with the responsibility of attaining universal health coverage by 2030. What this means is that in less than 10 years from now, almost every Nigerian should be protected by one form of health insurance or the other so that they do not have to worry about paying for healthcare out of their pockets. Health insurance under one roof is one of the initiatives that the NHIS under Professor Sambo is using to drive this policy. On the issues this week, we will take a look at what this initiative is all about. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
Some Nigerians understand what it means to have health insurance. They do not need to worry about money when illness strikes.
NHIS have advantage. Advantage is when we are not financial buoyant enough, NHIS it will favor you because most of the major surgery they will not charge you for any money.
We really enjoying it, but we know to sick is not easy, but when we go to hospital because of NHIS, we really feel good. They attend to us very well and quickly. They give us drugs. We just take everything home as if it's short. It's freely because of NHIS.
Not all Nigerians are so lucky. In fact, when the data on health insurance for Nigeria is quoted, it is said that less than 10% enjoy health insurance. Little wonder then that when Professor Muhammad Nasir Sambo came on board, attaining universal health coverage by 2030 was top on his agenda. Universal health coverage (UHC) means that all people can access quality essential health services without having to suffer financial hardship to pay for healthcare. Nigeria ranks 187 among the World Health Organization (WHO) ranking of 191 countries on UHC. Providing health insurance is, however, a chain of services. Stakeholders involved include health insurance agencies, health maintenance organizations, healthcare providers, employers of labor who provide funding, donor agencies, federal and state governments, etc. One thing that Professor Sambo identified to make UHC a reality was the need to bring all stakeholders on board towards achieving a common goal. Hence, Health Insurance Under One Roof initiative was born.
When we undertook our analysis of all the programs and the challenges, and we now recognize the fact that NHIS now is now the sole agency that can provide universal health coverage. You need involvement of states because they have their own social health insurance agencies. So as part of the coordination effort, how do we coordinate the system of the health insurance scheme? We now develop a concept of health insurance under our roof. Health insurance under our roof. It is a new concept that we introduce to bring about all the actors within the National Health Insurance Scheme to work in a coordinated manner.
This initiative was designed to eliminate bottlenecks, fragmentation, and operational disunity existing in health insurance operations, as well as to specify areas of coverage for state social health insurance agencies and other stakeholders in the health sector. Other efforts to further actualize the health insurance under one roof is the resolution on the matrix of coverage, which was formed during one of its stakeholders' engagement with state social health insurance agencies.
The matrix of coverage is like trying to identify roles and responsibilities of the federal agency as well as state agencies. Then we now say, okay, under the health insurance under our roof, NHIS should cover all the employees of the federal government. State health insurance should cover all the employees of state and local government. Number two, NHIS should cover all the big organized private sectors who have offices beyond Abuja. then state health insurance agencies should cover local manufacturers, private sectors within their states.
Another critical move that has helped solidify the move towards UHC is the Basic Healthcare Provision Fund. The fund is an avenue to give health insurance to the poor, aged and vulnerable in the grassroots. The vehicle most appropriate to this is the state social health insurance agencies.
By the provision of the National Health Act, it should go to the state health insurance agencies. And because those agencies are closer to communities, then they will now, the money will be used to enroll the vulnerable segment of the population, the poor, the poorest of the poor, the elderly, the women within reproductive age, and children under 5 from a family of low socioeconomic status. So when we came in, I told you there was no harmony between the NHIS and the State Health Insurance Agency. So there is very difficult to even get to implement that. That is very difficult because you need to come together, talk together, develop operational manual together, develop framework for monitoring and evaluation, and develop mechanism of supervision, reconciliation, and so on and so forth. So that health insurance under one roof was very handy to ensure the implementation. So we now streamline, during our retreat of health insurance under our roof, we now streamline the fact that the monies, as recommended by the National Health Act, will come to the National Health Insurance Scheme, and National Health Insurance Scheme will in turn remit it to the state health insurance agencies. So we now stabilize all these things.
States play a very critical role in the attainment of universal health coverage and by extension the health insurance under one roof initiative. Dr. Adeni Yogini, Chairman Forum of State Social Health Insurance Agencies, speaks of the initiative.
So the health insurance under one roof is just an innovation of the new leadership of the NHIS to bring everybody involved in the health insurance ecosystem under one umbrella, and that we can have, the industry regulated and then coordinated in such a way that we can have unitary, even getting towards having an electronic platform that will be operable by all, and then we can have interoperability, and we can handshake, our data can handshake and everything. So collection of data concerning the number of lives in Nigeria that's covered will be very easy, because real time, as people are registering, we can get it across to the NHIS data server, and then everybody knows these are the number of people that are covered in this country at this particular time. And aside from that, other operations can become regulated and coordinated. That's the essence of health insurance under one roof.
Health insurance under one roof has several advantages and has yielded several benefits for the health insurance ecosystem.
The coming of the health insurance agencies, you can see that when NHIS gives its figures now of coverage, it's higher because they can aggregate information from all of the states. Since we're working together, they're able to get the information on how many lives are covered at the state level. And aside from that, it is giving direction. In the first instance, when the Basic Healthcare Provision Fund was brought to the table, there was a lot of issues because there was no stakeholder integration, there was no inclusivity in the development of the manual, so it could not be operated very well. But with health insurance under one roof, we are speaking together with the ES, NHIS, the states, CEOs are working together. We're able to look at the manual, see the areas of the manual that cannot be operated, improve on them.
There was the need that Nigerians should move together, because if states run a parallel system and the NHIS runs a parallel system, you want to know the number of Nigerians that are benefiting from health insurance. The figure will continue to remain abysmally low. But with health insurance under one roof, it means what we're doing in Taraba State, what the NHIS is doing, and what some other, or rather the remaining states of the Federation and the FCT are doing will all add up, and we'll be able to say, oh, Nigeria is on course towards achieving universal health coverage.
Aside state social health insurance agencies, other stakeholders laud the Health Insurance Under One Roof initiative for what it can do for health insurance in Nigeria.
With the health insurance under one roof, it is no more the issue of this is what NHIS has covered so far. We are talking of this is what health insurance has covered so far. So with the state support health insurance we have, which is open to the 36 states of the Federation and FCT, we are thinking that universal health coverage will be better achieved as NHIS has been decentralized. So since it's decentralized, so nobody now looks around to say, oh, look, all the blame and the buck passing of the blame will go to NHIS alone.
That's a very new and positive initiative that has taken off and is already showing its acceptance. And the one thing is going to enhance the fast delivery of universal health coverage in Nigeria, where we have both the state and the national health insurance schemes and community health insurance schemes all coming together to synchronize and get one way acceptance of the scheme. Universal health coverage is definitely the way to go.
Welcome back from that break. Easy access to healthcare continues in our stakeholders segment. Our stakeholder for this week is Dr. Patrick Ikenna, a Chief Medical Director of International Clinics and Hospital Limited, located in the ancient city of Kano. He shares his thoughts on a series of issues bordering on health insurance in Nigeria. He begins with a brief history of the hospital.
International Clinic was established about 40 years ago in Kano, and we have evolved from a 6-bed hospital with 2 doctors and 6 nurses to about 40 beds with about 15 doctors and 40 nurses. So over the years, we have enlarged our costs, and we thank God for that.
For Dr. Patrick, healthcare in Nigeria is still evolving and there is a lot that can be done.
Well, the healthcare system in Nigeria, we still have a long way to go, I must confess. But those of us who are left behind in this country, as you are quite aware, most doctors have left the country. Those of us who are left behind, we are determined to ensure that we improve on what is available. And that is what I can say. But a lot needs to be done in this country, and hopefully we get there someday.
He describes the implementation of NHIS in Nigeria as very timely. He says the scheme has done a lot to facilitate healthcare delivery.
NHIS, I would describe it as an organization that came on time. They came to the system on time when most of us and the healthcare in the country were almost directionless. So I would say they came to streamline the services, medical services in this country. With the NHIS, people who have stayed at home for lack of money now are sent to the hospital because they go pay next to nothing when they come to the hospital. You don't have to save a lot to visit any facility. You can, because you already have a provider hospital, you just walk in and access treatment. That to me is a lot of relief for most Nigerians. The good thing about NHIS is that you are sure of a certain amount of revenue every month. So with that guarantee that you get some money, you can plan. Here in particular, I would say where we find NHIS very handy is in the issue of payment of salaries. We are sure that at the end of the month or at the beginning of the subsequent month, some amount must come in. So to me, the salary for my staff is guaranteed when I pull in the NHI resources. Then also for capital investments, I will also say that if you want to do anything that is capital intensive, you also have NHIS handy because it's a certain and guaranteed income for most hospitals.
Dr. Patrick speaks on some challenges bedeviling health insurance in Nigeria and what the NHIS can do to improve its operations.
In the past 2-3 years, the cost of Medicare has increased a lot. And if a patient must get the right quality of treatment, then we must get something extra. Fee for service, like I said before, is also pretty low. The current fee for service charges are very low. And I think NHIS did something recently to add a 25% increase. But that to me is still a far cry for what we want. I will advise NHIS to go to town and find out the actual costs of rendering services.
That was Dr. Patrick Ikedna, Chief Medical Director, International Clinics and Hospital Limited, Kano State, speaking on issues surrounding health insurance in Nigeria. Up next on the program, your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: are the elderly covered under the NHIS?
The people working in the public sector, the age of coverage depends on the age of retirement. For example, if you are just a civil servant that retires at 60 years, after 60 years, you are out of the system, does not mean that you cannot continue with the system. If you now begin to contribute using the GFSHIP platform. 2, if you are a university professor, it gets up to 70 years because of the retirement age, or academic and non-academic workers in the universities, they get to 65 years. But as we speak, there is a committee going on, with ministerial committee we are working on to see how we can get out insurance for retirees and the elderly. That is a work that we are doing now, and we hope that it's going to bring a foot through, so that once people retire, they will continue enjoying NHIS.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIS.
As I sign off, I want to urge you to take advantage of the various health insurance options available to you and your loved ones, particularly under the GiftShip program of the NHIS, to protect yourself from out-of-pocket expenses when medical emergencies arise. You will be glad you did. Until I come your way again next week, spread the good news of easy access to healthcare for all and stay safe.
Easy access to quality healthcare for all.